Pacing checks. When you have a patient on an epicardial temporary pacing box such as this, 2 checks you can always do. 1, your battery check, and 2, make sure that you have spares on the back stuck on with sleek, not with cloth tape, because cloth tape is hard to get off in a rush. So for the purposes of demonstrating this set of checks, you have a patient who is in 70s sinus rhythm. In order to do any pacing checks other than the battery check, you have to have a warm patient who is not pacing dependent. So here we have the backup pacing set at a rate of 60 in AAI mode with an atrial output of 4 and a sensitivity of 2. The first thing we're going to check is the atrial sensitivity. You can follow this along on your green card. Step 1 is to reduce the rate to 30 beats a minute. Step 2 is to reduce the output to its lowest level, 0.1 of a milliamp. I refer to this as hamster pacing mode, as it's enough output to pace a hamster but not a human. So if this goes wrong, you will not cause a contraction in your patient's heart. At the moment, the blue sense light is flashing, and that's 1 flash for each of the 68 to 72 beats a minute that the patient has intrinsically. Now, to check the sensitivity, I'm going to make this pacing box less sensitive. It's going to look higher up the graph of millivolts until such times as it cannot sense the patient's intrinsic beat and the blue light will go out. So if you look at this number, I'm turning the dial anti-clockwise, the number goes up, 2.5, 3, etc. And at some point, the sense light will go out and the pacing light will start flashing at the 30 beats a minute. This won't be pacing the patient because remember it's set at hamster pace. Oops, maybe we better give it one more. Okay, so it's consistently pacing the patient at 30 a minute. I'm going to make it slightly less, come down and make it so it's consistently sensing the patient at 3 millivolts. So it's found the top of the P wave at 3 millivolts consistently, and we set that at half. You can't actually set at 1.5, so you get to choose between 1.6 and 1.4. The choice is really quite arbitrary. Moving on to checking the output. The first step, if you look at your green card, is to change the rate on the pacing box to 10 above the patient's intrinsic rate, which here is 68 beats a minute. So we'll change it to 78 on here and gradually increase the atrial output until we start to see pacing spikes appear. They'd be in blue on the main monitor. They should appear shortly. Here we go. As you can see, they're inconsistent and they're not causing a corresponding contraction of the atria. And you're seeing both the pacing and the sensing light here. So we continue to change and turn it up. This is now appearing to be much more consistent correspondence of a P wave to each pacing spike. And also, if you see here, the patient's rate has jumped to 78 beats per minute. That's at an output of 1.5 milliamps. So we double that, 3, and add 1, and set the output. 1.5 was threshold, so we set the output at 4 milliamps.